All right, welcome. It is Nazi from the Pulse of New Hampshire. Time for Well Adjusted with Dr. Sam Ayan from Infinite Health Family Chiropractic. Dr. Sam Ayan, please give out the new address if you could.
I am at 126 Loudon Road in Concord, New Hampshire.
So before we get into your segment today, because we do have a lot to talk about, one thing that I want to mention, we are in the week of Memorial Day. And yes. One thing that I want to mention about Dr. Sam that he doesn't really talk about too much because he's very humble. Dr. Sam is a very, very proud supporter of veterans, both still serving and past serving. And I know for a fact that you have spent some time at the Veteran Cemetery in Boscawen placing flags on the graves. And I just want to say, as somebody who comes from a military family, thank you very much for all that you do. I really, really appreciate that. And you also do something else special for the veterans who come into your practice, correct?
Yeah, so we offer a military care plan where if someone has just come back from deployment within the last year, we give them 12 months of care at our expense. And we also, for veterans themselves, we give them discounted fees. However, right now with the VA, a lot of them can get approved through the VA with the local community type programs that they are allowing, and they can see other doctors. So, yeah, and it is. I lost a friend in Beirut in '84. He was a Marine. He was a sharpshooter. So I have a lot of affection for what these guys and gals do to save our country and give us the freedoms that we well deserve.
That's really cool that you give back. So that's much appreciated. All right, what are we talking about today on Well Adjusted? And we have a really special guest. I can't wait to get to our guest.
Yeah. Oh my God. He's actually in Lincoln, Nebraska. Dr. Linn Erickson. He is an expert in his field. He talks. We're going to be talking about posture, how it may have some detrimental effects, the neurological components, how it may affect brain cognitive function, maybe a small case study, and the importance of continued care and why the posture is an important part of that. Now, if we don't get through all of that, one of the big things is our contact info will be flowing through the bottom of this, our websites and things of that nature, and the importance of seeing your local chiropractor and finding out more. So this is just a taste. So to sort of whet your appetite and get you going and figure out, hey, maybe I should get checked.
Without further ado, from Lincoln, Nebraska, Dr. Linn Erickson from Turning Point Chiropractic. Thank you so much for joining us today, Dr. Linn.
Hey, Dr. Linn.
It's great to be here, guys. Yes,
yeah,
wonderful to be here. Thank you, Sam, for having me on. Dr. Paul Fernhammer, I used to do radio for many years, and I haven't been on for a couple, so it's great to be back. And Nazi, it's nice to meet you. I realized I need to have a radio handle. I need to have a nickname for the radio.
How about DJ Linn? I like DJ Linn. I think that's got a good ring to it. You know what I
mean? That works. That works. That'll carry over to my second career as a rapper. It'll be great. No, Dr. Sam, you have to be on here.
That's a whole different segment. He could be rapping. I love it. I love it. Yeah. All right, take it away, Dr. Sam.
Yes.
So, Dr. Linn, you're out in Nebraska, Turning Point Chiropractic, and how long have you been in practice?
When you asked me that, Sam, I was thinking about this. It'll be 30 years next year. It's the days are long, but the years go by like that. So yeah, it'll be 30 years next year.
Yeah, 30 years. That's incredible. And my question, was you'll be teaching at TLC's seminar in a couple of weeks. Actually, it's about 9 or 10 days, and you'll be teaching about posture, and that is one of your areas of expertise. And one of the things that I really want people to understand is that it's not just about the aches and pains going into the chiropractic, but really about how it affects our livelihoods and how healthy we are. Why is posture so important in regards to understanding where your health may be at?
Well, it's a great question, Sam. So here's my thing, Dr. Sam. When I was in chiropractic college, I just remember thinking about how dentists are known for dental hygiene. If they are known for one thing, they're known for taking care of your teeth. And in chiropractic, we should be known about taking care of your spine and nerve system. And regardless of a person's condition or the doctor's technique, how you're built really matters. And so for me, when I looked at just how the physical world works, because I have an interest in, sports and other things like that, is just that how things are built really does determine how they work. If I go to a car lot with you and we see a car and we say, this car looks great, but it actually has square wheels, I'm not buying that car until something changes, because I know I'm not going anywhere with square wheels in my car. It has to have round wheels to function properly. And so our bodies are very much like that, that when they're built properly, there's major implications for how our human frame is able to withstand the forces of gravity, move, and actually keep our nerves healthy. And so for me, structure determines function, and that's where I always start and try to help my patients with that as well too.
So there's obviously a structural component. It's something that I speak to a lot of my patients about, in the sense of an automobile. If an automobile has a misalignment, you may not feel it right away, but eventually it starts to worsen and wear down and have some detrimental effects on the body, not only physically from the standpoint of degenerating the spine, but also organically in some of the visceral organs and things of that nature. Now, I want to caveat emptor, buyer beware type thing. We're not saying that we have the heal all end all for everything, but there is an effect that it has on our body. So some of the detrimental effects that we may have with poor posture. I mean, poor posture is a sick posture. It may, you see somebody that's sick, usually their posture is deteriorating and they don't look well. What are some of the effects that may happen from some of the studies that you've looked at with poor posture?
Great question, Dr. Sam. So what I would say is that your central nervous system is where you live your life. Everything that you do, whether you're talking about the 5 senses we learned about in school, moving, thinking, planning, listening to music, all this stuff happens through your nervous system. So if the nerves are healthy, there's great things happening in your body. If your nerves are not healthy, you're not a well person. And the more that becomes involved, the worse it becomes. And usually it progresses towards very bad things. So structure of the spine has a big influence on how well those nerves function. And I thought of 4 things, Sam, when you asked that question. One is, we know for sure that people actually have bad posture. They just break down faster and worse than people who actually have normal posture. It's just like driving a car with abnormal alignment. Things wear out faster. Number 2, they're much more likely to actually have pain syndromes and things that don't allow them to enjoy life as much, because they have this warning sign going off all the time about the damage they're creating. Number 3, you mentioned Dr. Heidi Havoc when we were preparing for this. Dr. Heidi Havoc has shown, she's a chiropractic researcher, has shown that there's a portion of your brain called the prefrontal cortex where we actually really make the biggest plans of our life, how we think things through, how we plan our lives, how we react to things. And when you have bad posture and have subluxations, what we commonly call subluxations or misalignment in your spine, that part of your brain is actually turned down. You actually have less ability to think and plan your life, and you're just dealing day to day in fight or flight with all the pain you have. And then lastly, the thing I thought I'd understand that really should get our attention is there's certain misalignments in our spine that actually reduce the blood flow to our brain. Now, when you think about oxygen coming in, nutrients getting bad, waste products coming out, if you're being starved for those things, that really has major implications for what's something called age-related mental decline, that sort of thing when at age, a certain time you start saying, where did I leave the keys, that sort of stuff. Dementia, which is, an early onset of major nerve changes in the brain. And then lastly, Alzheimer's. There's all sorts of implications that what that would mean for progression and the side effects of those illnesses. So posture is not just about looking, better in your standing around. That's a good thing. I aesthetically, it's great to see good posture, but there's so many good things that come from that I can't imagine a person would not at least want to know, how is my posture, and get checked and have it corrected as best they can.
Right. And, interestingly enough, this morning I was, I was preparing, something came up on my screen about habits that we can create to avoid dementia. So it's interesting that you recognized that particular, and those are the habits that we have to work on and break. Not break so much, but make sure that we have the good habits that we're practicing, because every habit we have it changes the plasticity of the way our brain, or what they call the neuroplasticity, and the way our brain responds to things, how we stand. And that's what Heidi Havoc was really alluding to, is the plasticity of those frontal lobes and how things can change, and how we can avoid the progression of disease. Now, again, what's the important thing is, this is one component of taking care of yourself. And as a lot of people will come into any of the chiropractic offices, or go to any doctor, oh, well, I exercise, I eat right, I do all these things. However, they're not addressing the structural component that helps to give you the foundation of everything that's going on. And you alluded to that earlier, how structure and function go together, and all of those other things are good. However, if you're exercising on a structural deficiency, or something posturally that's off, you could actually be causing more damage than not. Isn't that correct?
That's correct, Dr. Sam. Basically, we are an accumulation of our habits, for better or for worse. The good news is that with good habits, you can actually train your system and posture to do some wonderful things as your normal habit and status of being. The flip side is, if we do lots of not so good things for our posture, we become that. You show me what a person does for the majority of their day with the posture that they're in, whether it be sitting, standing, leaning back in the sofa, whatever it may be. I can show you what their posture, with a high predictability, what that's going to look like. And yes, the solution to a car that's out of alignment is not to drive it faster. We don't need to push that hard. That's actually what many people are doing. They have the best intentions with exercise, and sadly they get injured because they're not structurally built to handle that sort of abnormal. They're not built to handle the loads of the stress they're putting on themselves, whether it be weightlifting, competitive sports, CrossFit, you name it. But get that structure taken care of. You can push that to the maximum that you can personally do.
Right. And, it's interesting, because one of the examples I use, because we use the automobile as an example, a lot of us do push ourselves at race car speeds, but we take care of ourselves like a family car. And there's a huge difference in taking care of yourself, because, you change your family car, you change the oil every 3,000, 5,000, now 7,500 miles, but a race car needs to be changed every week. They take it apart and put it back together. So, like you said, going faster doesn't solve that issue. And these are the type of, and there are a lot of studies that have been done through chiropractic biophysics, through Heidi Havoc with the neurology, through some of the other esoteric techniques that are out there. Just by contacting specific areas, you can change the way things are going to respond. And it's interesting that people feel that they can come in when they're just in pain, but pain is usually one of the last things that shows up. And yes, you had alluded to how pain is one of the things that you may have, pain syndromes. However, it's one of the last things that shows up in a process, and usually one of the first things that goes away. And it's really not a good gauge of health. So, having said that, why would you think that it would be important to have care, along with what you talked about, and continue care regardless of your aches or pains?
We've been using this car analogy, Dr. Sam, and I'm going to stick with it. So if the only time that you and your car in the mechanic shop, when you actually have a full-on breakdown or something is just really not working well at all, that is what we call crisis care. When you purchase a car, there's something in the glove compartment called a schedule of maintenance. It actually is something that you have, and it tells you here's how often to have these things checked, replaced, changed, whatever it is, to have optimum performance and lifespan of your car. And I believe in that. And I actually have a car I'm driving that I will be passing on to my daughter. It has over 160,000 miles, and it's still running really well. If you take care of your body in a way where you only take it in when it's broken down, we kind of call that hokey pokey chiropractic. I'm only in when my quote unquote back is out. And bring it in when things are just all broken down. And chiropractic can get people out of crises, but recurring crises are a sign that there's something that's not right. Something underneath needs to be corrected. And the beautiful thing, Dr. Sam, you and I have seen this in practice for as long as we've been in practice, that those people who have some type of regular plan to have their body evaluated for structural, have those things when they're found correct, just age so gracefully. They're typically doing way more than their peers are at the same age, just because their bodies are working at such a high level. They're not taking their care of their bodies in a crisis mode. They're actually always some schedule of maintaining it and actually forever improving it. There, we would call wellness care. Another now with bodies would be, if the only time you actually exercise is after you've had a heart attack and bypass, that's very much just getting over an issue. It's just getting over a crisis, if you will. People who exercise, on some regular basis, 3, 5, 6 times a week, they're not there to get over something. They're there to prevent, but also just to enjoy life at a higher level.
And Dr. Linn, it's if you had something, is there someone or some sort of individual that comes to mind for you that has portrayed the differences that we are talking about?
Yeah, very much so, Dr. Sam. I'm going to give you a little preview of something I'm going to share at the conference that you and I'll be at in 2 weeks. There's a gentleman who gave us permission to share his story. He came to us. He's a worker. He works with concrete, does a lot of heavy work, manual labor, and so forth. And one time, going back probably about 6 years ago, he was backing up in a enclosed tractor on a work site, and in also coming was a fully loaded concrete truck. Neither one saw each other. And even though they were only going about 5 miles an hour each, the cumulative effect was 10 miles an hour. That when you talk about the size, that's a major impact to a person's body, and he felt it right away. He actually had essentially a whiplash injury along with mid-back injuries from hitting against the seat. And he went the traditional medical route. He said, I have pain. I want to see what my pain is, all about here. And traditional medicine, they are great at saving lives. They're great at crises. But when it comes to examining and caring for it like we do naturally, just something they just don't train on in school. So that's what chiropractors do. He had already been released from his workers' comp case with what they said was chronic injuries. They said, we can't do anything else for you. And that probably is true. That medicine didn't have anything to offer him. There's no more drugs they could try. And there was no reason to do surgery. He just had to learn to, quote unquote, live with it. By the time he walked through our doors, he was actually having not only daily mid-back pain and neck pain, but actually when he would exert himself, he would get chest pain, like he felt like he was having a heart attack. So twice in the last number of years, he actually gone to the hospital thinking, I'm having a heart attack, I'm dying. And they said, no, it's just some sort of origin of chest pain. We don't know where it's coming from, whatever. Well, when I did his initial evaluation, Dr. Sam, even our patients could have seen his posture across the room, how abnormal it was. But guy just was beat up. And took 2.5, 3 months later of hard work. He had reduced almost all those postures by about 2/3, I would say. One of the best changes I've ever seen. But most importantly, he's back on the job now, literally has no pain. He's able to play baseball with his sons and
Excellent.
Have no pain. He can run, exercise, all things he used to enjoy. He's back doing those things. And he's now on a wellness plan because he says, if I've worked this hard to get this, why would I stop? So,
right.
Great story.
Yeah.
And Dr. Linn, and that's the big thing. We have a couple of minutes left, so I want to tie things up. And the big thing that is important is you reduced his postural distortions by 2/3, and he saw all those results. And he has a better quality of life. He's able to go out, play with his son, do things that he couldn't do before. That's truly the process with which chiropractic is about. It's not just about getting you out of the discomfort. Yeah, it's to help you get out of discomfort. But what are those things, Dr. Linn, that can improve your health and help you create a better quality of life and neurologically? And that's what I would recommend for people is go get checked. It doesn't mean you need care.
Yep.
It just means get checked. And what I'd like to do, finish up, is if you mention where you are again, Dr. Linn, and then I'll mention where I am, and then Dr. Nazi can tie
I
it.
like that. DJ Linn and Dr. Nazi. We could swap.
Yeah, DJ Linn. So, Dr. Linn, if you could tie things up for us on your end,
Yeah, right.
where are you located, and what and how can people contact you? Oh,
yeah, I would just encourage anybody who had an opportunity to hear this process to and have their systems evaluated. Dr. Sam, you and I think, are both big components of this. We would love to just screen people, give them the chance to see where they're at, just a basic cursory screening. Let me take a look at your posture and see what's going on. We are located in Lincoln, Nebraska, in the southwest portion of Lincoln at 34th and Old Cheney. We serve the entire Lincoln community. We're about 15 minutes from everywhere. And we love doing what we do, Dr. Sam.
Yeah. And I'm Dr. Sam from Well Adjusted. I am here at 126 Loudon Road in Concord, New Hampshire. Our phone number is 603-753-4455. And our website is infinitehealth.biz. And if you guys have any questions, just give us a buzz.
Excellent. Gentlemen, thank you. See you next time on Well Adjusted on the Pulse of New Hampshire.